welcome everybody. Thank you for joining us for this session. My name is Inga Chernova. I am director of Upgraded, Health Association of Finnish Startups. Our organization was founded in 2012, and at the moment we are a network of more than 70 active startups from the health scene of Finland and also international ones. We deliver a lot of projects every year. One of those is a mapping project of health ecosystem of Nordic countries. So I would recommend all of you to stay tuned because we may have something very interesting to share with you soon. And also soon we will have our own event, Health 200, which I recommend you to attend. And this session, as you all know, is dedicated to smart healthcare, probably one of the most important topics nowadays, because after the COVID-19 outbreak, we need to be as smart and efficient as possible. And we have our amazing speakers with us who's gonna tell more about how to optimize healthcare solutions in the surroundings of our new world that was formed after the COVID-19 outbreak. So first, I'd like to pass the mic to Lieke van Kerkhoven, co-founder of Flow2 Healthcare, and she will tell us how sharing helps create resilient and healthy healthcare. So, Lieke, you're on.
Thank you, Inga. I'm going to share my screen. Thank you for the introduction. I am with you from the Netherlands, and I'm one of the founders of Flow2 Healthcare, and we facilitate the sharing economy for healthcare organizations. And how that works, I'll explain later, and also why that became so relevant after the COVID crisis. We started in 2012, and we have evolved quite a bit since then because we started with open sharing community, Flow2 Healthcare, and our idea was that every healthcare organization in the world could share their idle capacity, their supply or their demand, and then they could connect through our platform and then optimize usage of those resources by sharing them, renting them, borrowing them, and buying them from each other. But in 2012, this whole practice was really very new. So everybody said that's a great idea, but nobody was really doing it. So we have evolved, and at this point, we make closed communities mainly for organizations internally, but also for closed networks of organizations that already have a trust relationship and that want to share resources as well. Just to briefly describe, because I think everybody here is familiar with the circular economy concept. So this fits in the part where you optimize usage of what's already available. We facilitate that supply and demand can meet efficiently. So we make better use of the resources and the energy that is already out there during the life cycle of products. Well, how does that work? Like I just described, we create a digital platform that organizations can use internally, and that can be organizations with various facilities spread geographically, or it can be a hospital that has different departments that also has a lot of capacity everywhere in those departments that are not really aware of. So employees from that organization can actually put the capacity that they have standing idle, and it can be equipment, but it can also be excess stock. It can be facilities that you're not going to move, but you can have the capacity of that facility on the platform. You can make it visible so that your colleagues can see it, and then if they are looking for it or they're about to order something to go into a procurement process, and they go to this platform and they see actually that someone else in the organization has it available, they can connect and come to an agreement whether there's money exchanged or not. The transaction goes through the platform, and the item exchanged goes from A to B. The same principle works between organizations. So then just one organization says that they have something available, or they are looking for something, and another organization can connect to them, and then they can make the transaction, and well, everybody happy, we hope. The main reasons before the crisis to start sharing is, of course, financially, because if you optimize usage of your already available capacity, then you save a lot of costs. It's actually a procurement tool that organizations use to avoid procurement of new goods and services, but rather optimize what's already in the house. Of course, it fits in the circular model because, well, like I just described, you have less waste and spillage of energy and resources. And another important reason that some of our clients start using this is that they want to enhance collaboration, because the sharing creates connections between various employees or regions or departments of an organization that are usually not very collaborative. In most healthcare organizations, every department or every location is very much stand on their own. They're not really communicating about, well, they're just going about their daily business. So some organizations say we want to stimulate that collaboration, and by exchanging information about goods or equipment, we actually want to enhance the connection and create a win-win situation in that. So that was going quite well, and then the crisis hit, of course. And then another reason for sharing became very clear, namely that there was a huge mismatch between supply and demand, at least in the Netherlands, but I believe that was everywhere. Everyone was looking for something, and the supply of those goods and services was not in the normal, usual partner. So a lot of the PPE came actually from businesses that are in a completely different field of business than the healthcare organizations. Here in the Netherlands, we had regional networks that, you know, every organization had to fill out an Excel file every morning saying how much supply of certain PPEs they had and how much patients they were expecting. And then the central coordination would actually compare all those Excel sheets and then manually redistribute all the goods so that the organization that had the most patients would actually get the resources that they needed. So it was a lot of man work and inefficient matchmaking going on there. So the need for a centralized place where everybody can find what they are looking for became very clear and also very urgent. And efficient matchmaking, well, that was necessary. And we also saw, actually, because the collaboration was necessary, but we also saw that it was possible, because many obstacles that were previously preventing collaboration between organizations were now just taken away within a couple of days, and you know, goods were flowing freely between organizations. I want to share some examples of platforms that we have running right now, just to make it more descriptive. PharmaSwap is one of our leading platforms at this moment. It's an initiative that we started together with 2 pharmacists. And it's a platform, it's a closed platform just for pharmacists. And these pharmacists said, well, there is a lot going on about medication wastage, but that mainly deals with medication that's already been with patients at home. So it's very difficult to redistribute, because you don't know if they were stored properly and if they are still in the proper condition. But there's also a lot of waste going on within our pharmacies. And this is medication. It's usually quite expensive because it was particularly ordered for a certain patient because they were on a prescription, but then the patient dies, or they move, or they change therapy, and that expensive medication remains in the pharmacy. It's typically not medication that you hand out every week. So it just sits on the shelf until it reaches the expiration date, and then it has to be destroyed. And this is not something that rarely happens. It's actually quite often, if you're honest, as a pharmacist. So they said, we actually want to make it possible for pharmacists to exchange this medication. And basically, it's already happening in a very informal manner. They were exchanging requests through WhatsApp. And then these packages were sent through the regular mail. And everybody would just sit really tight if things worked out, because they were packages of several thousands of euros sometimes that were going through the regular mail, and you don't know if, you know, how these packages are treated underway. So they said it's happening, it's informal, we want to make it more professional and also facilitate safe transportation of these goods and packages. So that is why we started PharmaSwap. Originally, we flew it below the radar because it's actually not allowed for pharmacists in Europe to trade medication amongst themselves. You need a wholesale permit to be able to sell medication to a pharmacist. But we had been to the Ministry of Health, we had been to the inspection, and everybody was just referring us to each other. So we said, okay, let's just prove our case. And we started with 20 pharmacists in a closed network, and we exchanged a couple of packages. I think it were a little over 60, and we were able to save 50,000 euros procurement value just within a couple of months with these 20 pharmacists. We published these results then, and we won several prizes. And then we opened it up. So now we have over 150 pharmacists, and currently there is 345,000 worth of products on PharmaSwap, and we have saved over 200,000 euros this year. And now we actually got to the phase that the health inspection says, okay, we realize that this is illegal, but we also see that there is a lot to be gained. If we don't do this, then all this medication will be wasted. So not only for the cost, but also the resources. Medication production is the number 3 most ecologically hazardous procedure in healthcare. So it's really worth trying to save as much as you can. And health inspection has last week given us permission for 1 year to continue doing what we already do. So they're actually going to allow pharmacists to sell medication to each other. And in this year, we have to organize our business in such a way so that it becomes within the rules. And since this is European legislation, this is very interesting because the potential is so much bigger if we can roll this out through the rest of Europe. Well, like I said, we won several prizes, Innovation Award. These are the pharmacists that we work with. Another example, and this is very nice because it was initiated during the crisis. The Canadian Coalition for Green Healthcare reached out to us and they said, well, there's actually a lot of mismatch in supply and demand that we've noticed during this crisis, and we think that one of your platforms could actually help create the transparency that we need in one central place and then also facilitate efficient matchmaking. So we started a collaboration with them for the Canadian healthcare. Healthshare.ca, it will be launched somewhere next week, which is basically a platform for every healthcare organization and health-related business in Canada, because there are also a lot of businesses that have capacity or services that are very relevant for healthcare, but because that's not their normal business, they couldn't really reach the healthcare organizations. So they said we also want to be on this platform because that we can, for example, pivot our production to produce PPE instead of mattresses or something like that. So this is really, it's a healthcare platform, but it's also available for non-healthcare organizations, particularly in times of crisis. It will be launched next week, and then we'll see if that will help, hopefully, in the second wave. Oh, sorry about that. Oh, it's going to the website. Oh, it's doing it again. I'm sorry. Okay. So also in response to the crisis, and I'm really eager to share this with you because it's really in the development phase. We are evolving further because we want to be able to provide the care branch with something that's really helpful in times of crisis, but in order for it to be sustainable, it also has to have a value outside crisis, because we don't know when there will be a new crisis, if there will be a new crisis, and perhaps the next crisis is not about PPE, but injection needles. So you need something that's more resilient and more flexible than just increasing the stock of the items that we were needing so much in the COVID crisis. And we are calling it digital storage rooms or virtual warehouses. And it basically comes down to one big warehouse for the whole of the Netherlands in this case, but it's like health share, it can also be for other countries or regions. And organizations that are big enough can have their own digital storage room under that big national storage room. So if you're a hospital or if you're an elderly care organization with various facilities, you can have your own digital storage room, which just means that you have a digital place, one place, where all supply and demand from your organization can meet. And that is very handy in times of crisis, but also outside crisis times, you can use it to optimize usage of your furniture and all the other kinds of stock that you have, or staff, or the facilities that you run. So it's basically a sharing marketplace, but then, you know, it's upgraded a little bit. It can communicate with your procurement software, for example. And then in times of crisis, we can open up just parts of your own storage room to become part of the bigger regional or national storage room, so that the whole of the region or the country has one place to go. Also non-healthcare organizations, if they want something, if they need something, or if they have something to offer. So I'm really curious to the reactions of this. So if you have any feedback, please share it with me, because we're just developing this, and I'm talking to a great variety of partners, from general practitioners to directors of hospitals, also the traditional suppliers, people from the government, because this is pretty big and it needs a very solid basis to be able to work. This doesn't work if we have two hospitals with a digital storage room. It needs to be well, further spread across a region or a country if this wants to be successful. So if you have suggestions, then please share them with me in the chat or afterwards. This is what we're working on right now. The benefit of this, because this is our core business, is that we can also connect to other platforms we have. So we can connect this digital storage room to PharmaSwap, the example I just showed you. But we also have a platform that's called Park Sharing, which connects all the business parks in the Netherlands. So if there is something happening that, and you want to involve the traditional businesses, it's very easy for us to connect that together and connect them also to a central place for healthcare. We have several European projects like Werflink. That's an example for the Belgian construction market. So this is just to show you that this principle can be applied to a great variety of businesses. It can be for a certain profession, like the pharmacist, but it can also be to a certain region, like the Belgian example, or for one organization, such as the upper left corner, which is just one hospital. That is what I wanted to share. I'm really looking forward to any questions, and thank you.
Thank you. Indeed, really brilliant presentation, and I think this is a great thing you're doing with all of your platforms and projects. That sounds Thanks. Very impressive. Do we have any questions at the moment? So we have the chat part on the right side of your panel. So if you have any questions, if you just add them there, or also speakers can just unmute themselves and ask questions straight away. Okay, we have first one. Hi, Lieke, good initiative. When exchanging used products, is there a quality assurance of these used products?
Yes, Pierre. So first of all, it's a professional exchange between organizations, like any other exchange would be. So you usually have a contract or an agreement underlying a transaction, and in that agreement, you of course specify the quality or the state of the product or service. And actually, one of the reasons that we want a centralized platform in the Netherlands is that we had some stories of one procurement professional from a hospital who had some extra PPEs, and they were sending them to another hospital. But then that hospital just used different criteria to assess the quality of their PPEs, and that those PPEs coming from one hospital were not approved by their quality standards. So they actually destroyed them whereas in the one hospital they were just used, and then so some form of agreed quality we should be incorporating in this digital storage room. So it should be some form of I don't know, labeling or certifying. I'm not really a fan of introducing new certificates, but we would have to find a way to find a common ground for quality that everybody can work with.
Thank you for your answer. Makes sense. We have one more question from Raj Java. I'm sorry if I don't pronounce the name correctly. And the question is, how is the cost of running the platforms shared between users? Is it transaction-based or a fixed fee?
Yeah, so our current platforms work with the subscription fee. Usually the pharma swap one has a transaction fee. But for the storage rooms, I think we should also work with a subscription fee, that every organization just has a subscription. And then different employees can just sign up and do their thing, so they don't have to be bothered with paying per transaction or paying new subscription fees. So that is something we're working on, but I think we're going with subscription.
Nice.
Yeah.
Do we have any more questions? Maybe someone from the speakers want to ask something from Lieke? Well, maybe I can ask meanwhile. How many hospitals at the moment are you partnering up with globally?
Globally?
Yeah.
Well, I can't really, it's different because we have the public sharing platforms like HealthShare, and then we have the private ones. And the private ones, it's not so big yet. And for this storage room, I'm trying to set up an alliance of organizations that are joining as a sort of launching partners, because like I said, this only makes sense if you have a coalition of users already, and not just one, because then there's no value. So I'm trying to gather a coalition right now of at least 10 or 20 hospitals here in the Netherlands to launch this, and that is in the developmental phase.
I see. Thank you.
Yeah.
Is there anyone else with a question? We still have some time for Lieke's presentation, so maybe somebody still wants to ask something. No one?
It's all clear?
Well, it seemed pretty clear to me, I must be honest, and pretty impressive also. I really, really love what you're doing indeed. By the way, how is IT security and all the regulations are being set in place for your platforms?
Well, of course we work with the highest standards of the requirements for digital platforms and the sharing of information, all according to European law.
Nice. Yeah, and we have one more question from Alexis Rocampeur. Again, sorry if I mispronounced the last name. And the question is a digital storage room could be used for sharing HR?
Yes. It's also actually one of the questions we got from Canada, is that they said on the one hand, we have so much staff we need, but we also have huge amounts of staff that were actually, that they didn't really have work for, because parts of the hospital obviously closed and they wanted to restaff them. Mm-hmm. So yes, you can. We also saw during the crisis, but then on our park sharing platform, so that's for the business parks, that some of the businesses they had, their business fell away because all of a sudden they couldn't do anything anymore. Whereas other businesses on the same business park, but then more digitally oriented, they all of a sudden needed a lot more capacity in their warehouses. So we actually saw that some of the businesses were exchanging staff so that the people could stay at work, but also that the other businesses could keep their business and fulfill the increased demand.
Wow.
Yeah,
that's impressive.
That was really cool. Yeah.
It is.
Yeah.
Maybe there is anything else you would like to add or to also to ask?
Well, I want to ask if people are out there and listening and see an applicability for example, for this digital storage room thing, or if they think, well, it may work, but you have to change this, or you might have to look there, or could we use it for this, like the last question from Alexis, please reach out to me. And because like I said, this is a joint effort. We need a coalition to get this going, and I really want this, but I can't do it alone. So just feel free to reach out. Will the presentations be shared actually with people? I think so, right?
I think so, yeah.
Yeah.
Do you want to create a poll maybe at the end for people to vote for it?
Should I create a poll?
Let's create a poll if we want a poll. But basically, yeah, we heard your question, and I think this is a very nice call and a really nice initiative to support. So you can reach out to Lieke in Deal Room. I think the platform will be open, well, at least during the whole day today, and I believe we'll have access to it even after the event. So just send her a direct message or schedule a meeting, and everything can be discussed there.
Thanks, Inga.
And thank you so much.
You're welcome.
Our next speaker in our session is Jan Buthke. Jan is a computational design lead from Lieke Arkitektur, and he is about to speak about digital leverage in sustainable architecture. Are you with us, Jan?
Yes, yes, I'm here.
Yeah, so now I will pass the mic to you. You're welcome, and let's start our second part of the session.
Well, first of all, thank you very much for inviting me to come here and talk a little bit about what we are doing right now at Lieke Arkitektur. My little keynote is about how parametric design enables us to create more for less, enhance sustainability through increased performance. And my name is Jan Buthke, and I'm recently employed here as computational design lead at the end of last year. My background is I'm an educated architect, and I've been working and practicing architecture and also teaching and researching at the York School of Architecture. Well, first of all, a short introduction to Lieke Arkitektur. Lieke is one of Scandinavia's largest architectural groups with 15 offices and 500 employees across the region. So we are both in Denmark, Norway, and Sweden. And what are our areas of business? So like healthcare architecture is our DNA and forms the largest business area in the group. With nearly 200 staff dedicated to our work in life science, we design and manage construction of hospitals and research facilities all over Scandinavia. And in addition to that, we also have a lot of other business areas, of course, like residential, education, urban design, commercial, and industry. I have like two quick projects that I want to show you that we are proud of and are pretty recent. The one you're looking at right now is UH Forum in Aarhus, where I also are located in Denmark. The second one is the just recently inaugurated extension to the Rigshospital in Copenhagen, which is the North Wing that we won about 10 years ago. So those are the kind of buildings and the scale of the healthcare buildings that we are working with, and those are not necessarily the biggest ones. A little bit about the office. We are doing healthcare architecture since 1986, and back then things were quite different. And then in Denmark in 2007 there was a change in legislation which demanded a quite big digital innovation in the entire building industry, at least working for the state or the country. and that like triggered a whole development within the entire industry, but also at Link Arkitektur, where we became experts in what is today called BIM, Building Information Modeling, and now we're basically taking the next step into what is parametric design. Well, that's where we came from, and that's where we are now. So going from entirely analog to almost entirely digital. So when I was employed, my job was to develop a strategy for this new parametric development, and basically map out the possibilities that are like within the field of parametric design. And this could be like an image of what we are working on right now within my field, which are digital collaborations, which could be virtual reality, augmented reality, all kinds of data sharing. What we are really focusing a lot of on are optimizing workflows, and that's both across companies, but also in-house. And of course, one of the biggest themes, enabling sustainability through digital tools, through parametric tools. Efficiency improvement. We are facing a lot of pressure from the market right now, especially now after the crisis, where the fees we can charge have been getting lower and lower. So we need to get more efficient to continuously be surviving on the market. And then one of like our in-house focus is architectural quality. How can we use parametric design to enhance architectural quality? And architectural quality is basically what is the generated by architecture on top of like the physical environment. And then buildability. How can we like challenge, let's say, our sustainability approach through buildability? Can we build more sustainable, and how can we do that? So parametric design at Link is growing rapidly. We call ourselves Link.io because we are still architects, but we are working with the data more than our maybe more traditional colleagues. So Link is creating space for better living, designed by people based on knowledge. And then Link.io qualifies with performative analysis, documented with quantifiable processes, designed with parametric tools, manufactured through digital fabrication. So we are not neglecting the work of our colleagues. We are just trying to enhance and make things easier. So it is our vision to support the continuous process of architectural improvement and to enhance the way towards a more sustainable and performative architecture. Just very briefly about like a strategic diagram. Link Arkitektur is a really big company, and we're trying to like grow from inside, and we're trying to establish new relations to other players on the market. And first of all, we're trying to get engaged with the academia to do more like qualified projects through academic research. So we are trying to set up some industrial PhD programs together with our School of Architecture right now, and other collaborations in terms of innovation with other universities in Scandinavia. And then, of course, we are trying to like support all the different segments and especially healthcare. So what can we actually do with parametric design? So we can, it's easier to understand complex relationship in context. So we get a bigger insight. We can enhance the performance. We can take quicker decisions because we get a greater overview, and we can take more qualified decisions. We can enhance communication both internally but also externally. We can be more flexible because we can set up parametric models that are like changeable all the way through, and we can have a better way to control to quality control our projects because of the enhanced overview. So what we especially are working with. Oh, sorry, this is actually still Swedish. Some of it. There are like three main fields within parametric design. There's the analysis, there's the automation and optimization. And those three fields are each massive fields. But if you want to make a real comprehensive parametric model, we need to take all of them into account. So the analysis is just like qualifying our work. The optimization is making us more effective, or if we can make things faster. And optimization is then enhancing the quality eventually. And this is of course like an iterative loop that will like be replayed again and again. And now working parametrically, we can suddenly generate a lot of different solutions, and we need to then afterwards be sure that we can evaluate those and pick out the best ones. So which is the best? So we need to like benchmark the different results, and very often there are multiple objectives, and none of them can be like reach 100%. But it's always about finding a compromise. But how do we do that? And that's this is one of the big headaches in the building industry right now. There are so many different stakeholders, there's so many different objectives. So how can we actually make the right decision? So we're trying to work with like adaptive systems that are parametric models that can adapt to different situations. And by this it can be like a tool for decision making, because we're not like locking in the model on a very early stage. And we are working with logical processes. So this is a plan, looks very familiar, like an architectural plan, like as every office is like maybe drawing them. But working parametrically with this plan, we are able to automatically generate and also change afterwards, and the result is maybe not the final result, but it's a very good proposal that then could be adjusted eventually. And the biggest challenge in parametric design is complexity. And in computer science, it is common to categorize problems in terms of their NP hardness. It basically, well, that means that it's defining the property of a problem that is informally at least as hard as the hardest problem to solve. So and what that basically means, it is a measure for how long it takes to solve an issue. And because in architecture, so there are so many objectives, many of the problems that we are facing are in let's say the hardest category to calculate for a computer. If we're trying to break this down, when we're working with parametric design, it is to define a possibility space, and this possibility space will then offer some designs, and within those designs, some might be performing better than others. So it's about to locate those that perform the best, and just to make it even more complicated, we could add like the third dimension, or even more dimensions to like the solving of parametric problems. And maybe one example could be this housing project, which is a very, let's say, classical architectural project. Can be, but there are, let's say, a million different solutions to it, and we could just sit down and, as architects have done always, and design a good solution. And we could also try to use an algorithm to help us to generate and let's say locate some valid alternatives, which we then can continue work on as architects to enhance and ensure the quality. What we are working with a lot in architecture is scale. And when we are looking at a building is basically an envelope, and the envelope contains floors, and the floors contain apartments, and the apartments contain rooms, and so on. And if we are able to connect all this with a procedural or parametric model, then we can basically design at all the scales at the same time. And that's how architects work. Mostly architects work in different scales at the same time. They might be jumping constantly between scales, from urban scale to apartment scale. So creating a link between macro and micro scale maintains flexibility between scales, and makes us more effective working. The computer is not necessarily doing our job, but it's just enhancing our job. So one more example, before I go into a specific healthcare project. So again, looking at the generative design, this is an office layout with a specific program. The algorithm is laying out the program on the plan. It can be done in a million different ways. And then afterwards, all the different generated layouts can then be benchmarked and can be evaluated according to some specific demands. And there can be done some analysis afterwards to check the quality and the performance of the space. And then on top of that, the model is also very easy to change because everything is set up parametrically. So we can do some easy, quick changes to the overall geometry, and everything else will basically just follow. And those are some of the more recent developments, which also are very relevant to the healthcare segment, because it is basically an early phase sketching tool that helps us to lay out some volumes on an early stage. And this is very effective when we're working on big hospital projects with 100,000 square meters or even much more. Because it is so time consuming to model everything up manually and do the changes. It's much easier to have a quick sketcher, make sure that all the square meters are there, that all the necessary spaces are, and the program is distributed right. We can even do some quick analysis in the beginning, like daylight analysis, wind analysis, sound analysis, and so on. So now, just check my time. Oh, sorry, I lost the screen. I'm sorry.
We can still see it.
Okay, good. How's my time? Where's my time?
I think we have around 5 minutes before the Q&A, but it also depends how many questions people will have. So
okay.
basically, we have 15 minutes total.
Okay, fine. So this is, let's look at the North Wing project. The North Wing, I was briefly introducing it in the very beginning. It just inaugurated at the beginning of this year, and it has been transformed for a period. It had been transformed into I think they had some corona it transformed into something that could like be used for corona, but now it's almost back to what the original use. But let's talk about the design process, because this is a project that had been developed far before we started to think about parametric design, and it's a very successful building in terms of its architecture quality, but also in terms of performance in many ways. And so now we need to learn from our past, and we need to look into what works and what doesn't. And the biggest problem with this project is, and every other competition we do within healthcare, is that because of the complexity, they are very time consuming, and we're not sure that we can like invest as many time into those projects as we had been in the past. So how can we like optimize that? So looking at this project, it could have been designed with parametric design because it has this inherent logic to it. So traditionally, if this would have been built as a parameter project, then there would only have been 60% of the rooms facing outside. So we decided to like just put everything out as like one long strip. All the rooms would face outside. That would generate some good views, and but maybe the distances would be very far. So what happens if we just basically bend this into a shape like shown here, and we could even generate some like inner courtyards with some really nice green atmosphere, and then eventually everything could be connected with like some kind of a highway cutting through longitudinal to the building. And here the same as like three-dimensional visualizations. So the quality of this project is the courtyards, the views, basically the connection between the different areas of the hospital, and what if we want to like achieve something similar with parametric design? So we're looking at some design principles that we could use, and it's like algorithmic design. Parametric design is based on a set of rules, and let's say from the same sheet of paper you can both fold a butterfly and a sparrow. It just all depends on like the different folding operations on the way. In let's say in generative design, which is like based on the rule set, is also based on evolution. So we can basically set up an algorithm that is evaluating for us and picking the fittest, let's say, entity in a data set, and then by this basically evolving a fit solution, not necessarily an optimal solution, because there's nothing such as a perfect solution, but it will like start to pick out some solutions that might be better than others. So we have to set up the design problem. We have to do an analysis of the outputted results, and then we need to select the optimized solutions. And this is basically a collaboration between the designer and the algorithm. So design problem, there's some variable parameters that can be changed by the designer. There's an algorithm that is defined by, let's say, a developer, which could also be an architect, and there will be an output. And this output will then be fed into this loop again and can be modified multiple times until the result is basically good enough. And in this case, we're talking about a multi-objective solver because there are multiple objectives that we want to optimize. And there's noise, which is very important in a hospital, because it has a negative effect on the health or the getting well of the patients. Then there is their views. They have evidently a significant impact on the recovery of patients. There's daylight, which also has a significant impact on the recovery of patients. There's spatial variation, which is important in terms of orientation and general comfort. And then there's distance, which has to do with the performance of an hospital. And so we've been working a lot with what I've been showing you before, with housing and urban design, where we've been developing some already pretty well-developed tools. And now we're trying to further develop those into tools that can specifically be used in healthcare, and to being able to do projects like the North Wing, but driven by a parametric design idea. So we are basically generating a lot of solutions, and then benchmarking those again, like I explained earlier. And then that's where the designer comes in and then supports the algorithm, or let's say the algorithm had supported the designer. And then we're also working on, let's say, an opposite bottom-up approach in contradiction, which is basically trying to solve a building from the smallest entity, or maybe the most important entity, which could be the user, could be a patient, could be a doctor, could be a nurse or the cleaning staff. So it's trying to map out the different routes, the different visitors or stakeholders are taking through the hospital, and it's trying to optimize the layout of the hospital according to the different user groups. So this is basically an opposite approach, but it's also a way to evaluate the generated designs. One could say essential to the successful Link's algorithmic-driven process is the inscription of the designer into the algorithm. And this is always the discussion today, parametric design. It's not the computer that is designing the buildings, but the computer is enhancing our design process. So value-based architecture, such as healthcare architecture, must base itself on scientific facts, while also relying on the designer's competencies based on experience and empirical evidence. And maybe this is also the reason why I chose to work for Arkitektur, because there's so much knowledge encapsulated into this office, and especially in terms of healthcare. And what I find really interesting is how can we use this to drive some parametric models, so that the key to the parametric design basically becomes the empirical knowledge that is embedded into the people working here. So yeah, thank you. That was basically what I had prepared for today.
Wow, thank you, Jan. Thank you for your presentation. First of all, beautiful designs indeed. I wish I knew about your software when I was redesigning my apartment. That would have made my life much easier. And of course, as a psychologist in the past, I'm also really happy to learn that architects like you nowadays are considering factors like lighting and design towards mental health care and healing component for the hospitals, because I have seen some hospitals in my life that definitely were not contributing to good mood and to your general well-being. So that's really impressive. I think you're doing really great, important job here. So question yes, we do have our first question now from Ingrid van Herde. And the question is, does your design process also make the building flexible for future use?
Well, it could, if that would be one of the objectives in the solving or the design. So definitely, but not not without any, let's say, we need to take action, and then of course we can build this into the parametric model.
I'm trying to understand the question. Like, do you mean, Ingrid, whether what was designed before can be redesigned for some changes in future? Is this a question? Or how do you, Jan, understood it?
I mean, I can understand it in two ways. One could be, well, if a building that has been designed for a specific use, let's say for as housing, how can we make sure that it in the future could be used for something else, so that we don't have to tear down the building? This could be one thing. This would be very much in the ethos of circular economy, and of course there are ways to do that. So then we need to maybe look into some design for disassembly. Maybe if we want to disassemble, or it could also be making sure that like structurally it is so flexible that it could be reconstructed for other use.
If the building will be used for other forms of housing, so if you can repurpose it in the future, I guess. But I guess
yes, of course we could take this into account. But it's very specific, of course. So right now we're in Denmark. We're building a lot with concrete, and then in Norway they're building a lot with wood, which also are two different systems and two different structural challenges. But of course, this could be taken into account.
Nice, thank you. I think we have time for one more question. If anyone wants to figure out something. So one more last question from our attendees to Jan. Someone to figure out. Okay, so there is a long one from Mina. Hi, Mina, by the way. Very interesting presentation. How early do you, the main contractor, involve subcontractors such as smart technology, functional materials, interior planning project? Dialogue, interaction between the end users, facility management, the main construction company, and does your designing model go all the way into say, innovating procurement as it comes to materials, technology, sustainability, scalability, modularity? Thank you. That was a question.
That was a big one. Let's say, of course, when we design hospitals, we take most of this into account, and very often, of course, we team up with other experts within the field because hospital design is so complex that we can, of course, not solve everything ourselves. But in my field, like it was the parametric design, let's say we are in a very early phase or stage of that part. So as for now, we're not like building most of those aspects into our parametric model, which does not mean, of course, that it's not part of the project development. What we do, of course, is a lot of sustainability, scalability, modularity also. But I mean, materials, of course, but the more like technical parts that you're mentioning, maybe not so much in the parametric model, but more on the, like, let's call it conventional design.
Okay. Yes, thank you for your answer. I think we ran out of time for this part of presentation. Thank you so much, Jan. If any one of you have more questions to Jan, you can also send him a message through Deal Room. Always be in contact. Deal Room, I think, will be available to you after the event as well. So,
thank you very much.
Yeah, thank you, Jan, and talk to you later. And now we are ready to move directly to the premises of DTU with our third speaker, Irina Lindquist from Schneider Electric. She is a healthcare segment manager, and Irina will speak about energy and climate smart healthcare.
Perfect. Thank you very much for having me today. I'm going to start by saying thank you very much, DTU and Nordic Center for Sustainable Healthcare. It's now probably the third or fourth year in a row when we are invited, and we're glad to speak and share our perspective and our knowledge in this field. I think it's an important topic, and I'm humbled and honored to be here. I must say that I do need to have some help to share my presentation because I didn't quite get it up and running. I will like to start by sharing with you whom Schneider Electric is, and as we do it most of the times, we try to say whom we are. I'm not going to do that. I'm going to try to introduce you to whom we're not. So hopefully we can hear this very short video, 1 minute and 20 seconds.
The world is full of people telling you who to believe they are. Well, we thought we'd tell you who we're not. Let's start here. We're not in shipping. We don't make lifts. Seriously, no lifts. We do this. We're good at this. And we make all of these. And even though you'll find us here and here, we don't make energy. We make you save it. And you'll be saving the environment too. Are we an internet company? Well, we connect and power just about everything around you. Helping machines talk to each other and to you. Making your world more personal. We're seeking out the big questions and answering them honestly. Like, how can we make the most of our energy and resources? Or can we make access to energy and digital basic human rights? We're real people, employees, developers, partners, investors, and inventors, all passionate about doing what's right. We're open. Humans of all sorts from all over, learning from each other and about each other. We're not here to save the world. It'll go on with or without us. We're here to help power and connect what you do every day, to ensure life is on everywhere, for everyone, at every moment.
Really great video.
Yeah, we hope we make it justice. I thought it would be easier for me to share with you that video than give you a bit of an introduction of whom we are. So why Schneider Electric in a sustainability and healthcare sustainability conference? It's very simple. It is in our DNA. And we always said that it is our responsibility with all this accumulated experience and knowledge and other technologies that we have accumulated to stand up for a more sustainable future. So we look at where we stand today, and as we see it, we're still on the green path for 3.5 degrees global warming, even though everyone has made a pledge and so has been starting to look at ways of making their operation more efficient. So if you look at climate change, it is all about emission, right? And if you look at emissions, it is all about energy and efficiency. So we say that 80% of carbon emissions are due to energy consumption. The consumption has multiplied tenfold during this century, and it will go 4 times more by next century. So this is all happening in a world where 60% of the way we manage the energy is inefficient. Right? So with that being the burning platform for my presentation today, I would say that we are here to prove or to be a role model in our own industry, but we are also, and step up our sustainable development goals, but we're also here to help our customers and our partners and the ecosystem of companies that are part of this to become more efficient and to save what we can save and manage more efficiently what we can manage more efficiently. We're here to try to take a bold commitment in line with the Paris Agreement and try to find the ways that we can find together with an ecosystem of partners to limit the footprint and the impact that buildings, industries, and healthcare buildings and healthcare and hospitals will have on the climate. We want to be a global model, as I said, and we have our own impact across sustainable development goals. But we're also here to leverage the know-how and credibility to develop business and support to our customers through our products and solution services, and together adopt a better way of doing it. The way we see that is that in the industry, there are two major disruptions. Yeah? There is an energy transition that is happening right now. And we need to see how we manage that better. And it's a digital disruption. Okay. With these two ways, we see a platform and an opportunity to try to manage energy more efficiently, but also manage process more efficiently. So that brings me into a platform for efficiency for a sustainable future. It brings energy efficiency through savings, through electrification, and through decarbonization. And it brings process efficiency that will improve sustainability of activities that we perform in wider world and in healthcare facilities. We will improve asset performance and the consumption of resources that our assets will require. Will improve productivity and efficiency likewise. So we need to make it possible. We need to make it possible in 20 years, right? We only have between now and 2040 to reduce 50% of carbon dioxide. And how do we make it happen? We need to find a way to save, electrify, or decarbonize, all of the above, right? So we see a pathway to achieving those sustainable goals. And if we look at our existing stock of buildings, if we take probably 2% of the stock and we retrofit and renovate and we upgrade, well, we're probably right on the path to achieving the level of saving that we want. If we take any new construction and we make it as efficient and sustainable as possible, then we are well on the path of saving towards a more sustainable healthcare facilities or healthcare in general. We need to electrify, right? Because electricity is the only vector that will fuel the rest of trends that come with a lot of things. I recall one of our customers that constantly asked me for the last 3 years I've been here, said, well, how should I project my electricity consumption and my electrical consumption for the new hospitals that I'm going to build in my region to allow for the full-on electric cars that will arrive on my premises, to allow for all of the wearables that patients will have, to allow for the pacemakers and all of the electric things that will need to be connected to charged in the future, because we don't build hospitals for today and tomorrow. We build hospitals for 20 to 50 years. Right? So we need to try to increase our efficiency of electricity twofold compared to other resources. And then we, of course, need to decarbonize. And we need to start looking more seriously into other sources of energy that will allow us to power the devices and the things and the buildings of the future. And I'm going to bring another trend because I do like numbers. I'll bring the digital trend. And today, more than any other time, we are all digital, right? The last few months of our lives have brought in more digital than before. And then you look at the innovation in technology that comes along in all aspects of our lives, let alone the healthcare sector. So we are looking at a speed of innovation in digital that is at breakneck speed, right? We look at 5G apps, we look at IoT devices in all aspects of life. We look at big data exploding, and we need to be able to manage it and to rein it, to learn from it. And we look at extreme advancement in advanced technologies, in modern technology, artificial intelligence and machine learning being just two of them. So I brought in some numbers and some trends. But now we go to look at social economic impact, right? So we're looking at, okay, we do have all of this extreme spectrum of technology and need for efficiency, but we are growing and aging population, and we will see ourselves struggling to cope with space efficiency, energy efficiency. So we need to start looking closer into possibilities in renewable energy, in occupant comfort and CO2 emissions from activities that take place in the space that we will all want to occupy, and that is in the cities. Then we look at hospital infrastructure. We say, okay, there are things that will always be in hospitals, but you look at Internet of Things, you're looking at mobile devices, you're looking at medical mobile devices, and you say, well, how would we manage this amount of data and this amount of things that will all of a sudden flood or be implemented in our hospitals for the purpose of managing patient care, for the purpose of securing patient safety, and for the purpose of becoming more efficient in the activity that we perform. So we look at possibilities to make hospitals being more connected and make a digital infrastructure or digital backbone of hospital that will be able to accommodate in gathering the data from all of the sources, in structuring the data, in analyzing data, and driving some insights in the process, and using those insights to actually solve the real life problems and look at driving the efficiencies that we all been promised that technology will solve, right? And then we see, okay, with all of this paradigm that we're looking for, hospital electricity consumption will, of course, increase, and will increase by 60%. Well, what would a hospital need to do? What would a regional hospital need to do? Perhaps look at self-generation, perhaps look at source management, perhaps look at demand and supply balancing, but most importantly, look at reliability and availability of electricity sources, as well as energy efficiency. So these are the things that we probably all expect that has happened or have happened or will be happening. However, every time when we start looking into a broad holistic assessment into one hospital, we tend to find that the silos that exist in the healthcare infrastructure have not come together, and the data remains in chaos. And there's little correlation that we can make in between one system and the other by just attaching them one to another are not possible, because we remain and we are closed in the silos that we are. And yet again, the 4.8% of building stock that hospitals in the Nordics represent do actually consume 10.3% of the energy across the Nordics, right? So we need to do something in that area. So we say, good, the two simple ways that we can tackle this problem is perhaps if we manage to rein in the energy and energy management and automating the process. So if I'm going back to the beginning of my presentation, where I said, well, it's obviously a energy disruption and a digital disruption. That's how we at Schneider Electric understand that we can contribute to tame the energy dilemma. But why do we need to look at both energy and process automation? Because we need to get the hang of becoming more efficient and becoming more sustainable in the way we operate our healthcare services and our healthcare business buildings. We also look at co-innovating, and we look at collaborating, and I will come back to that point a little bit later in my presentation. We need to co-innovate not only around technology, because technology is here and now and will help us go so far. We will need to get a better understanding of efficiency and also sustainability priorities that converge in some way with operational priorities. And why would we want to do that? We want to do that because apart from being a hospital where people go when they're sick and uncomfortable, it needs to be more engaging. It needs to be more engaging for staff and visitors, but it needs to be more engaging for the patient. Yeah? It needs to be more efficient or hyper efficient. So we need to find ways of driving that extra efficiency into the hospital buildings that will make the building more engaging and more pleasing, but also safe to operate and safe to provide care from. It needs to be truly sustainable. Right? And I'm going to step on that or stay on this point a little bit, because in the Nordics, unlike other countries, we do have the privilege of having progressed most of the traditional sustainability initiatives, and we're trying to look and find ways of doing more. Where would we find more? We will find more if we collaborate and innovate, and if we will find more if we start looking into the data insights that are collected, two perhaps can be correlated in between systems in the buildings and in between buildings in a campus of hospitals. And what do we need to do? We need to make it simple, because we can't drive all of these complicated, complex concepts with even more complicated, complex technology if the recipients or people that receive our advice cannot understand it. So we need to make it simple. We need to make it accessible. And why do we want to do that? Not because we need to have super digital hospitals, but because we do want, right? But because we need to be able to drive the right information to the right person in the right way. And in this context, enable patient safety, enhance patient experience and operational efficiencies. But are the organizations prepared? Are the healthcare organizations prepared to take that on board? We've had the privilege of running a survey across 240 customers of ours in the Nordics, and we asked, well, are you prepared to take on the new energy equation and the new energy dilemma that is put before us all, with a new set of targets, a new set of great ambition? And about 85% of the companies that we've interviewed said, of course we are. Yes, we are. We've got it. We have it in the plan, and we're following it truly, and we're ready to go there. Then we asked a set of other questions. We said, well, how coordinated your planning is in between internal energy teams and sustainability teams, because they sometimes are. And 44% of them said, no, it's not really integrated. We just work in silos. Then we asked how holistic your energy and sustainability management strategy is. And 40% of companies said, yeah, well, perhaps we're not that connected. Then we said, well, have you looked into broadening the spectrum of your energy sources that you will be powering your hospital facilities and hospital systems with in the future. And I thought, well, perhaps we didn't actually look into the energy storage and demand response strategies. So, well, what do we need to do to secure a more rapid evolution of this ecosystem? So there's obviously silos inside a building, and there's silos inside in between systems. There are also human silos, and perhaps we need to bring them together in a more consolidated ecosystem to drive just this, the energy transition and the digital transition across the life cycle of a healthcare facility, with engagement from all of the stakeholders that could potentially have a say or a decision point or a touch point into this. So that brings me to collaborating across a closer ecosystem and broadening that spectrum more and more, because yes, we do have collaborators within or closer to us, like tenants and services within building. We do have architects, design offices, system integrators that do have a strong hand in how buildings are designed and how buildings are operated and so on. We do have utilities provider that could, of course, make or break some of the decision and some of the financial impact that we drive with efficiency in energy and automation. But we also have real estate service providers or non-for-profit organizations and contractors and other distributors that could contribute. So what if we are refocusing the conversation from a conversation between companies to that will engage to achieve one goal in the context of one building or one campus, to communities? Why don't we want to have a community of supplier, vendors, and customers solving the energy problem and the energy dilemma together? And how about we put the problem or the issue forward in a more holistic way, so that we enable this open ecosystem of energy management and automation to create and drive the commitment from all parties to create those solutions that will help us get one step further to the actual sustainable goals, and collaborate and celebrate the diversity of views that you will get in such a community, but also be able to scale effectively the solutions that you're able to drive with such a broader contribution, with a broader set of perspective. Which brings me to the technology point. It gives you context for data, and it enables you to connect, collect, analyze, and drive meaningful insights from data, but also it will help you take action. See, visualize, and produce the results that you expect, not from technology alone, but from ideas and perspective that all of the stakeholders will bring to the table. And that is what we think will prepare the healthcare sector for the future. It's a little bit more and a little bit more than what we do now. But if we look at integrated energy and sustainability strategies, if we look at connecting assets and analyze the information that we have from the various perspectives that a broad variety of stakeholders are bringing to the table, then we will be able to respond to new opportunities that this creates for us. And that will probably bring me to an end to my presentation. And I'm just trying to wrap up to summarize what I've spoke about. So I spoke about the environmental and burning platform for from climate change that probably affects us all and affects the healthcare sector more than it affects other industry sectors. I looked at giving you some technology touch points, but not technology by itself. I looked at bringing in socioeconomic factors that actually can contribute to the sustainability of healthcare facilities. We looked at collaboration as a catalyst for doing more and doing more faster, and of course eco-innovation. We looked at refocusing the conversation from companies or a small set of stakeholders that normally talk about energy efficiency and sustainability to communities of equally concerned stakeholders that will be able to bring different perspective. And I've talked again about more technology applied to the equation because, of course, there is a big promise in what energy and automation can do when combined, and the sustainability or the sustainable direction that we can follow on their path. With that, I will probably like to thank you very much for your attention and hand over to the moderator, to Inga.
Thank you, Irina. Thank you. Amazing presentation and also a very important question to discuss, a very major issue that we need to tackle all together. So I think we have time for probably one or maybe two questions maximum. So whoever is ready, please address your question to Irina in our chat bot.
I'm also mindful that I'm probably the only one sitting in between yourself and the coffee and the break that we're going to have after this session. So it's okay if I take the questions after.
Well, as I said before, you can also ask your questions directly to Irina as well in Deal Room, which is our tool for today. You will have access to it during the whole day and afterwards. Still have 1.5 minutes to answer to your question live in front of 38 people. I guess your presentation was so detailed and sufficient that people don't have any questions left. Everything seems to be pretty clear. Is there any questions from your side also, Irina, or any suggestions?
I think our pledge was clear and our commitment is clear. We invite any and all participants in this conference to engage and collaborate, and we're always open to take a perspective into account and perhaps find a new way of tackling sustainability in healthcare facilities.
Perfect. Thank you so much. So I guess we are about to finish our session of Smart Healthcare. Thank you everyone for joining and participating. Thank you to our amazing speakers, Lieke, Jan, and Irina. A huge thanks to DTU and Nordic Center of Sustainable Healthcare. And don't forget everyone to also attend Health 100 on the 7th of October. It's online event as well. Have a nice continuation of the event and have a nice day.
Thank you.
Bye, everyone.